I thought my nursing career was over. Burnout had drained me to the point where I questioned if I even belonged in healthcare anymore. But what if I told you that leaving the bedside wasn't the end of my impact? It was the beginning of something far bigger. In today's video, I'm going to share how I went from bedside burnout to building digital health systems that improve the lives of thousands of patients every single day. I kept up my license, held onto my scrubs and my stethoscope. I was ready at any moment to go back to the bedside. I wasn't convinced this digital health thing was real and sustainable. It certainly wasn't traditional. Are we still real healthcare professionals? I saw how predicted emergency visits dropped because of what we just did. 847 asthma emergency visits at a pediatric hospital, just gone. People who didn't have the emergency crisis, families who were better off. And that's not the only story. I saw how systems impacted patients' lives in emergency, home care, and the connection between the two. The systems I was putting in made real healthcare differences. I made more impact in 1 month through digital health than an entire year of bedside nursing. So real healthcare became how much impact I could make on how many people. It's not abandoning care, but scaling care. I had all the burnout symptoms at the bedside: emotional exhaustion, depersonalization with my patients, guilt that I wasn't working more, harder, later, more shifts, more overtime. Digital health is not an escape from healthcare. It's an amplification. It's setting us free to do what we're good at, from 6 to 8 patients per shift to tens of thousands across populations, from reactive care to preventative systems, from limited time to 24/7 solutions. I was a patient at one of the hospitals I worked on here in England. Broken wrist from a fall. Not an interesting injury, but after we parked, it was 1 hour and 15 minutes until we were back at the car. Triaged, x-rayed, medicated with a cast, and follow-up appointment. Just astounding. They didn't know who I was. I didn't receive any kind of special treatment. If you're a nurse, doctor, or clinical professional feeling stuck or burned out, your expertise might be meant for something bigger. Transferable skills like critical thinking, patient advocacy, systems awareness, these make clinicians vital to digital health careers. So here's my question for you. Do you see your clinical expertise staying at the bedside, or do you feel called to scale your impact beyond that? Drop your thoughts in the comments. I'd love to hear from you. If this video gave you hope or a new perspective, hit that like button. Share it with a fellow clinician who might need to hear this, and subscribe for more stories on healthcare innovation and digital impact.